Hello everyone, Fluffy here. Back with another, this is going to be a chat. Gotten such an overwhelming comments about my wanting to do a fibromyalgia video, and I was going to wait to do it after New Year, and then I thought, well, why wait? So here I am. God, it's kind of close up, but I'll be looking over. I've got my daughter's laptop up also, and everything's kind of precarious. 2 laptops on 1 TV tray, but we'll see how it goes. So I'll be kind of looking over to the side because I will be reading some of the research that I've done. I may have to click to get some more. I know I'm going to be messing up because there's no mouse for hers, and I keep trying to use the mouse, my mouse for hers. I know a lot of you know that I have fibromyalgia. It took me a long time to get diagnosed because nobody could ever find out what was wrong with me. And my primary, while he does not believe in fibromyalgia, he's like really old school, but he kept sending me getting tests and stuff run to figure out what the hell was going on with me because he did believe me when I said something was wrong. So I was kind of glad for that. So anyway, it was a rheumatologist that gave me the diagnosis, and quite frankly, I think that that's the only good thing that the doctors are for is at this point in the life of fibromyalgia is a diagnosis, because they really have no treatments except for experimental, and the actual diagnosis and giving you pain medication. So even my rheumatologist, every time I go, would apologize, and I haven't seen him in 3 years, so I really need to make an appointment and go. So, keep the paper trail going. But, it kind of makes me laugh because, well, it doesn't make me laugh, but the overview on what they say is all about fibromyalgia. This is coming from, and disclaimer, I am not a nurse, I am not an expert in fibromyalgia. Hey! No. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals. Symptoms sometimes begin after a physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Women are more likely to develop fibromyalgia than are men. Many people who have fibromyalgia also have tension headaches, temporomandibular joint (TMJ) disorders, irritable bowel syndrome, anxiety, and depression. While there is no cure for fibromyalgia, a variety of medications can help control symptoms. Exercise, relaxation, and stress reduction measures also may help. I believe when it says that more women have it than men, I think it's just because, and I could be wrong, like I said, I'm not a medical, I'm not a researcher, I just don't think men go for it. I think men think they're getting older, it's arthritis, even most of them, I'm not saying all, just refuse in general to go to the doctor. My hair looking like that over there. Refuse to go to the doctor, so I think that's why we get the diagnosis more often than men. They don't know what causes it, and I could say, oh, okay, I can tell you because I had this, but every single one of those activating events, so to speak, I've been through. So, and mine was gradual, and I can remember, and I don't know about y'all, remember, I want y'all lots of comments in the comment section. Mine started off slowly, and as far back as I can remember, I always had the pressure points. You know, people could poke me and it would hurt. The rest of the symptoms, you know, I always had tummy troubles, different things like that. But as I got older, the symptoms just started coming, you know what I mean? And to where it was really, really obvious that there was really something wrong. And then it took me a while. It took me many doctors to figure out, you know, what was up. Here it says, did I tell you where I was getting this from? I think this one was from the Mayo Clinic, Symptoms of fibro include, I cannot find, and I'll look in just a second, There's like 200 plus symptoms, but these are the most big ones that everybody complains about. The pain, widespread pain, the pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. I guess so it's not stomach pain. Fatigue. People with fibro often awaken tired even though they report sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. I really do think I have RLS, restless leg syndrome, and I will bring it up to my rheumatologist. It's just not diagnosed because sometimes I have to move my legs. You know, I don't know if it's because I can't get comfortable because I'm in pain, but sometimes my legs don't hurt, but they just don't feel right and I have to move them. So what I do, and 8 times out of 10 it works, which is something that you could try. And little man sleeps by my legs under the covers at night, and he's so used to it that he donkey kicks me and then either moves away or just puts up with it. What I do, if my leg needs to be rocked, I start rocking it harder, like really hard. And I'll do that for a few minutes, and then I'll stop abruptly. And my body immediately feels like super relaxed. And like 7, 8 times out of 10, it's in that period that I'll be able to fall asleep. If it's not, I'm not having any kind of other rough night, like the stress from a flare or whatever. But that tends to help my restless legs. And like I said, I'm undiagnosed, but it just all of a sudden started. So that was weird. And nothing had changed with me. You know, I didn't do anything extra. Cognitive difficulties. A symptom commonly referred to as fibro fog. Raise your hand if you suffer. Okay, I'm looking. That should be every fibro person looking at me. A symptom commonly referred to as fibro fog impairs the ability to focus, pay attention, and concentrate on mental tasks. Fibromyalgia also coexists with other painful conditions such as IBS, irritable bowel syndrome, migraine, and other types of headaches, interstitial cystitis, interstitial, interstitial cystitis, or painful bladder syndrome. Temporomandibular joint disorder. Now that's a mouthful, ain't it? I don't explain, but y'all can look that up. Temporomandibular joint disorder. Causes. Doctors don't know what causes fibromyalgia, but it's most likely involves a variety of factors working together. These may include genetics, because fibro tends to run in families. There may be certain genetic mutations that may make you more susceptible to developing this disorder. And when I read this before, because this is not the only website that I've read that part on. Remember I was telling you way back about the guaifenesin protocol, and guaifenesin is the active ingredient in Mucinex. Dr. Saint Armand, he is out of California, and he believes that fibro is a defect of the liver. So if it's a birth defect, then other members of your family might have it, and your body needs I don't know if salicylates, if it's a chemical, a protein, what it is, but it salicylates, and you find salicylates in everything and lots of foods, and your body needs some of it, but then your liver is supposed to process the rest of it out. And because you have a birth defect, the salicylates, the extra ones your body doesn't need, starts to develop and in pockets all over your body. That's what causes the inflammation, which is what causes your pain. I know sometimes when I rewatch my videos, I have like lumps in here. They're really obvious. And then I noticed a couple of them over here. Now some of this, like on my legs and stuff, is cellular because I'm overweight. I'm not stupid. But if you watch them, if you look, now, I mean, don't focus so hard on my arms that you miss the mukbang or whatever. But if you can see that I do have lumps, and so that's what he figures. So the guaifenesin, if you reduce your salicylates, like wearing gloves when you prepare food, stay away from certain teas, you even have to, on the protocol, get rid of personal hygiene items that have salicylates in them. And so you never get rid of the fibromyalgia because he feels like it's a defect, but you can reduce the symptoms enough to live your life that, you know, you go down to almost pain-free as far as the fibro goes. Only reason that I don't try it is because while you're clearing those pockets, you're in a flare constantly, like a ×3 flare. And so I'm scared of that. I barely function now when I'm not in a flare. So, but if that's something, look him up, Dr. Saint Amand. Somewhere in one of the videos, in my videos, I hold up, it's in my old laptop, so excuse me, I put a picture up for somebody because they wanted to know what book. Some illnesses appear to trigger or aggravate fibromyalgia. So, infections can do it. Physical or emotional trauma. Fibro can sometimes be triggered by a physical trauma, such as a car accident. I've had one. Psychological stress may also trigger the condition. I've had a lot of emotional trauma. Both before, during, and after my marriage. Now, whoever's spying, I said before. Why does it hurt? I didn't read this. We'll find. Let's read it together, okay? I'm hoping this is not too boring, y'all. I just think it's good information. Researchers believe repeated nerve stimulation caused the brains of people with fibro to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain, in parentheses, neurotransmitters. In addition, the brain's pain receptors seem to develop a sort of memory of pain and become more sensitive, meaning they can overreact to pain signals. And I guess that's where the pressure points come in, you know. People used to, my family, their favorite word is sissy lala crybaby. You know, you become a sissy lala, and I am a sissy lala when it comes to pain. I'm not good at pain. I mean, I guess nobody really is, but the pressure points, like right now, rubbing, that hurts me. That hurts. So I guess that can be true. Risk factors for fibro. Fibromyalgia is diagnosed more often in women than men, but I told you my opinion. I just think more men, if they actually went for their fibro symptoms, they would be diagnosed. I think that's a little off because of how men and women go to the doctor. Family history, you may be more likely to develop fibro if a relative also has the condition. I think my father had it, just knowing how he reacted to pain. He's passed now and never really, he wouldn't go. I mean, he barely went for his cancer. Excuse me, he had it a year before he decided to go do something, symptoms. I have a cousin that has it. I posted so many fibro posts. My immediate family got driven nuts with it, and I don't care because that's my illness, and I wanted to, try to get people to see what it is. And since then, I had a lot of people approach me for advice for friends or family members that recently got diagnosed. I feel honored. I'm not an expert, but I'll tell you what I know. And so my cousin approached me in a message saying that she has it too. Other disorders. If you have osteoarthritis, rheumatoid arthritis, or lupus, you may be more likely to develop fibromyalgia. And I guess because they have the same symptoms and stuff, trauma and illness can trigger it. And I guess it can turn your brain, the signals get off, you know. And I think that's why when you hurt yourself, like when I had my eye damage or and things like that, it can, I think it made my fibro worse. I don't think my fibro was here, and then I hurt my eye, so the fibro flare, I stayed flaring until it healed. But then when the flare went away, instead of resetting back to here, you know what I mean? I think the fibro stayed here. So it says the pain and lack of complications. The pain and lack of sleep associated with fibro can interfere with your ability to function at home or on the job. Okay, raise your hand if you can relate for both. The frustration of dealing with an often misunderstood condition can also result in depression and health-related anxiety. I believe that. I think that, you know, sometimes it's frustrating because people look at you and, you know, immediately judgment, especially me where I'm overweight. You know, my knees have been hurting a lot lately because I've been going to check the P.O. box more regularly. You know, I did activities with my mother and my family, and so my knees are hurting because of my weight. This I know. You see what I'm saying? I'm not stupid. I'm not going to blame every little thing on fibro. You know, I weigh such and such pounds. If you had that kind of weight sitting on your shoulders would hurt. So I know that's my knees. But people think that, you know, that's a whole nother diagnosis. In the past, doctors would check 18 specific points on a person's body to see how many of them were painful when pressed firmly. Now, that's how I got diagnosed. I got diagnosed with 16 of 18, and I can't remember which points didn't trigger pain. Newer guidelines don't require a tender point exam. Instead, a fibro diagnosis can be made if a person has held widespread pain for more than 3 months with no underlying medical condition that could cause the pain. I agree and disagree with that because chronic fatigue syndrome has almost the same symptoms as fibromyalgia, and when I read the two, the only difference, and so y'all tell me if there is another difference, okay? I'm going by what I've read, but I don't mind being corrected because I'm not a medical professional, is the pressure points. So I found that interesting, but that's got, you know, I had a questionnaire and I, yes, you know, and then the final thing was my pressure points. Blood test. While there is no lab test to confirm diagnosis of fibro, which is not true, I would love to know the date of this. The doctor may want to rule out other conditions that may have similar symptoms. Blood test may include, I know he did 3 major ones for me. Complete blood count, erythrocyte sedimentation rate, cyclic citrulline peptide test, rheumatoid factor, thyroid function tests. I know there was 3 major things and lupus was one of them. I don't remember him saying any of these. Maybe he said thyroid. I know I don't have rheumatoid arthritis because he did blood work because of my joints, and I didn't have rheumatoid and I didn't have psoriatic arthritis because I have you know, psoriasis. It can get in your joints, and I don't have that either. So there was 3 things he tested me for, and some of those, y'all, I really don't know. I don't know. In general, treatments for fibro include both medication and self-care. The emphasis on minimizing symptoms and improving general health. No treatment works for all symptoms. And like I said, treatments, medication. And it says self-care. That's not a treatment. That's not a medical treatment. You know, everything I know that helps me, and sometimes it doesn't, is things that I've learned, talking to other people, going through holistic things. Medications, oh, don't get me started, but I'm going to get me started. Medications can help reduce the pain of fibro and improve sleep. Common choices include pain relievers, over-the-counter, Tylenol, ibuprofen. Your doctor might suggest prescription pain relievers such as tramadol, which is Ultran. Narcotics are not advised because they can lead to dependency and it may even worsen the pain over time. A doctor told me they were talking to the ex about, because she's got chronic back pain, and it was a physical therapist that said for some narcotics, and I can't remember which one they were talking about, but he says, like, he goes, here are the nerve endings that go to your pain. And so you put the pill, I'm almost wanting, I think he wanted to say, not Norco, Vicodin. And Norco is Vicodin with less Tylenol. Now here's the pill, and so it's blocking the pain. Okay, so there's no pain. Okay, so you keep taking it. Over time, he said, and he explained why, and I don't remember, he said, your body will go a different route. And he said, so here's the pill, but then another receptor might develop over here, and another one might develop over here. So in order to get those, then you have to add more painkillers on there to get those. And it's so and so on. And that's how people get to dependent. And that's how people need more and more to help with the pain. So I remember him telling her that, and I found that very interesting. Whether that's true or not, or his own philosophy, I don't know. But I found that very interesting and very convincing. Antidepressants, Cymbalta, Savea, may help ease the pain and fatigue associated with fibro. Your doctor may prescribe amitriptyline or muscle relaxant, cyclobenzaprine to help promote sleep. I thought about, since my sleep has gotten so bad, when I do go back to the doctor, asking for some sleep medication help. I've always resisted because I don't work, which is good, so I can sort of manage the fatigue from sleep deprivation. You know what I mean? Does it suck that I can't sleep? Yes. Does it get frustrating that I can't sleep? Yes. But I'm in a position, and I know some of y'all aren't, where I can just lay it down. I don't have to go anywhere. You know, I have to get up enough that, you know, I pet the dogs, they come to me so I can play, I can throw a ball to Big Dog down the hall from the couch. I don't have to drive, things like that. You know, the mailbox can wait or whatever. So, I could kind of live with the sleep deprivation, but it's getting kind of bad. So I may ask for that. And Sarah Jane is the one that told me about Savella. There's two L's together, and like my last name has two L's together, and it's silent. Savella. And when I looked it up, it is an antidepressant, but it was made specifically for fibro. And so that's why I'm willing to try that. And I'll have to talk to my rheumatologist to see what he thinks or how much he knows about it. A lot of what I found, he didn't know about fibro, and he found what I found out very interesting. So, but at least he admitted he didn't know. And that's why I won't take gabapentin, because it is an anti-seizure medication. And we've gone over that in conversations. You know, the pharma, they get fined millions of dollars for and penalties and fines for off-label advertisement, because it is not a fibromyalgia medication. It is a seizure medication, and how they figured out it helps with chronic pain, I don't know. And Lyrica and gabapentin are the same thing. That's what my roomie said. He said he normally would prescribe me Lyrica, which has these ungodly side effects, but since I was already on the gabapentin for my back pain, he wasn't going to prescribe me Lyrica. And what I didn't tell him was I didn't take the gabapentin all the time. It made me feel funny. I didn't like it. I just suffered through the pain. And I had 2 big bottles I threw away because I refused to use them. So if you're using gabapentin and you're happy with it, then I'm not telling you to get off of it. Do what you and your doctor have discussed. I'm saying that I don't like it. It scares me because it's not a fibro medication. Anti-seizure drugs. There we go. I didn't see it. Medications designed to treat epilepsy are often used in reducing certain types of pain. Gabapentin, Neurontin in parentheses, is sometimes helpful in reducing fibro symptoms, while pregabalin, Lyrica, Lyrica was the first drug approved by the FDA to treat fibro. No, it wasn't, because they get fined all the time. I saw several articles about that. So, let's see. Therapy. A variety of different therapies can help reduce the effects that fibro has on your body and your life. Examples include physical therapy. A physical therapist can teach you exercises that will improve your strength, flexibility, and stamina. Water-based exercise might be particularly helpful. My doctor suggested Tai Chi. I could never get the movements right, and maybe it's my knees because of my weight. I just couldn't get, and it got more frustrating than it actually helped me. Swimming pool. The times that I could get in our big pool at the old house, I know you saw images of that. A couple of my videos, I turned it so y'all could see the pool at least once. While I was in there, it really did help. It really did help. But my problem is it was an above ground pool, and because I have PTSD, at least the psychologist I had to see for my disability said I had PTSD because of my fall. And he's right. I just wouldn't have labeled it that. Going up and down stairs still scare the living crap out of me, especially coming down the stairs. I get flashes of that tile floor that I fell on my face. You know what I mean? anxiety. It took me a long time to get in and out of the swimming pool, especially out of that pool. So I was only in it 3 times. Would you stop? I hear neighbors or someone. 3 times. So if you can do physical, I know somebody in one of the groups said what they did because they couldn't afford a gym membership, and I think only one of the 3 gyms in their town or something has swimming pools that they could use. They got with hotels, and they got with the managers and explained their situation and said could they use the pools if they came when not a lot of their clients were using the pool. So and they were able to go swim in a pool. I thought that was really cool. I don't have the nerve to go asking the hotel owners. Occupational therapy and occupational therapists can help you make adjustments to your work area or the way you perform certain tasks that will cause less stress. I don't know about y'all, how many of your employers would be that cooperative? Now, I was lucky that as I got more sick, the unit that I was on, even the one before, you know, I worked in the prison, so there's a whole list of things that you have to be able to do. They didn't discriminate because they can't. Americans with the Disabilities Act, they can't not hire you because you don't have an arm or because you don't have a leg. But with that appendage not there, you must still be able to do all the things that are required of you as a TDC officer. But my bosses tried to put me like in central control, where it was a lot more paperwork and things like that, where I could sit in between people coming through and stuff. And so I was very fortunate with that. But a lot of a lot of places they won't work with you. They already have a problem that you call in a lot. And I did, and it was very frustrating to me that I was not that reliable in the end. Counseling. Talking with a counselor can help strengthen your belief in your abilities and teach you strategies for dealing with stressful situations. If you need a counselor, y'all, because your depression, and there's a couple of y'all that emailed me, it would not hurt for you to go talk to someone. I know one person in particular who doesn't believe in counseling. You know, what good is to talk to someone? You would be surprised. You would be surprised if you got down, like when you talk to someone, even when you're telling like something personal, it's like you're here, it's hard to explain. You're here talking about it, but what's really underlying is way back here. And so you try to be polite and talk at this level, but you're afraid to let somebody in at this level. But if you went to counseling and you got yourself to talk at this level, it would help you. It took me a long time to realize that this is my life now. I do get sad sometimes because I can't work anymore. It frustrates me when people would make the comment that I didn't want to work. You know, and it gets frustrating because I even on Facebook, I see my friends, I'm off to work, or I'm doing overtime, or they took a picture of themselves in the car and I can see the uniform. Even before the ex and I split, I would see her getting ready for work and I'd be like, oh, you know, I want to go. But this is my new normal. You know, this is my life, this duplex. And I try to go outside that on the days that I feel good, because it does feel good to get out sometimes. There were times that I really didn't want to go, but life says you need to go and get those groceries from the Walmart pickup. So I would get in the car, and once I was in the car, because I was sitting so I didn't have to move around a lot, I kind of felt better to get out into the fresh air. You know, for some of y'all, it may just be sitting outside your front porch or your back porch, or being inside the house. If you really can't go outside, get a chair by a window and open the window. You know, sometimes you may have to take your day an hour at a time if you're feeling that bad. Okay, it's 10 o'clock. All I got to do is get to 11 o'clock. You know, I just got to get to 11. And once you reach 11, you're like, oh, okay, now I just need to get to 12 o'clock. And if you're in that bad of a flare where you really can't move around and you're bedridden, my suggestion, if you can help it, Okay, and I can say that, and I say this not having to be in bed for days at a time. There are some days that I really feel like I want to stay in bed. Those are few and far between where I just have no choice but to stay in bed. I tell myself, okay, the couch is still just like a bed. I feel accomplished. Ooh, look, yawning. I've been up since 8 o'clock. So I feel accomplished. Okay, you want to stay in bed. You know you shouldn't stay in bed. You got dogs that need you or whatever. Even if you don't have dogs that need you. Okay, let me at least get to the couch. Okay, so on the way to the couch, I have my kitchen. So I'll get myself a drink for as long as I can stand. I'll get myself something to drink. Saltines. Have you a stash. Have you a basket. It's not good food for you, but you could do bananas and apples and stuff if you have it. Grapes. Get ready-made food like I've done pudding pops, pudding cups. I've done applesauce. I've done string cheese because that's not bad for you. That's pretty good for you. Apples and stuff where you don't really have to move around. You could stay on your couch, and do things like that. It says physical therapy. I know one of y'all kind of really rallies against the fibro, and that's good. If that works for you, that's good. But I also know that you pretty much stay in a flare over it. But that's worth it to you. So for you, that's an accomplishment. So for some of y'all, you could try that. You thought, oh, I don't think I can do that. Try it. With my back, I have 2 fractures and a crack, and I weigh what I weigh. So it's hard for me to move around and stand up for long periods of time. Not only that, my fibro pain gets pretty bad. And it's probably because of the other pain. And I say that, but then a lot of other fibro people that aren't overweight have a hard time standing. So is it the weight? Could be. Could be a combo. For me, when I'm in a lot of pain, being as still as I can. Then I still move because I have to put the dogs out. I have to feed the dogs. I'll go soak in the bathtub. For me, y'all know, my miracle soaks. Epsom salt, and now thanks to cheese, the essential oil, lavender oil. Woo! Somebody needs chaga today. So you've got to find, what else do y'all do to help yourself? Self-care is critical in the management of fibro. Let's see what they say. Reduce stress. Develop a plan to avoid or limit overexertion and emotional stress. Allow yourself time each day to relax. That may mean learning how to say no without guilt. That's a hard one for us, isn't it, y'all? Especially when you have family and friends who don't understand what you're going through. But try to change your routine. But try not to change your routine completely. People who quit work or drop all activity tend to do worse than do those who remain active. Try stress management techniques such as deep breathing exercises or meditation. That's where the Tai Chi comes in. And I have said several times that me quitting work was both a blessing and a curse. It was a blessing because I didn't have the stress of thinking I would put somebody at risk by my physical and my eye problem causing another officer to get injured or stuff. But also, quitting work has made me very sedentary. Of course, I was very sedentary when I worked because when I got home, I didn't do anything. More than now. Now, on good days, I will get up and I'll load the dishwasher and I'll do some laundry and I'll do more stuff. But I think I do more moving now than I did before. So, but yeah, it kind of, for a while, accelerated my abilities when I quit work. Get enough sleep. Can't believe they put this up here. Because fatigue is one of the main characteristics of fibro, getting sufficient sleep is essential. In addition to allotting enough time for sleep, practice good sleep habits, such as going to bed and getting up at the same time each day, and limiting daytime napping. In a perfect world, this statement would be true for everyone. But I have found, and my daughter is the one that kind of absolved my guilt, because I would get faces from the ex about napping. But my daughter's like, Mom, if you're tired, go lay down. You know, even if that keeps me up all night, because my body kind of tricks you. How many of you all sleep in the living room and you're like, okay, now I can go to sleep. You go in there, you lay down, and then your body's like, just joking. And so I think you get more lack of sleep, or at least I do, by trying to force yourself to stay awake so that you can go to bed early. I try it all the time and it doesn't work, so I'm like, screw it. If I'm up from midnight till 7 in the morning, but then I can go to bed at 8 and sleep for 5 or 6 hours, why try to get more lack of sleep trying to reset? Because every now and again, my body will reset on its own, and for a few days, I'm bed at night, up in the morning. Like right now, I haven't had to nap, and I've been going to bed anywhere between 10 and midnight. Last night, it was like midnight, I think, because I was waiting for the second video to get up. But I sleep. If my body says take a quick nap, then I go nap. I don't try to fight it anymore unless I have to do something. Unless I have to go do something. I'll just let the sleep take me. I'll just go. Because I figure 2 hours at the wrong time is better than no hours at the right time. But that's just me. I don't know what y'all have tried. Let us know what you do to go to sleep. I try to relax. I try to watch videos in bed. Nothing very overstimulating. I watched the families from Sri Lanka, and it's called Village Life, and they show the older people, even one of the young people, making dishes over a campfire in these clay pots, and they eat a lot of curry, and it's just relaxing hearing those birds and stuff, and listening to the cooking sounds and stuff. And it's just very relaxing for me. And I'll do those, and I'll watch it, and then I'll sleep until the phone kind of falls on the pillow and I fall asleep, which is why the car bong was screwed up, because I didn't check the battery charge. But that's how I sleep. I'll soak. Another thing I do is soak in the lavender oil, or even soaking in when I'm run out of all that stuff, and I just soak in as hot as water as I can take. I get out, I dry myself off, and while my body's still hot, I try to crawl under the covers. Now, granted, I keep a leg out or a knee out or something to kind of cool myself down a little bit, but I find that helps relax me as well. And so that's what I do to try to fall asleep. Here's one. Exercise regularly. At first, exercise may increase your pain, but doing it gradually and regularly often decreases symptoms. Appropriate exercise may include walking, swimming, biking, and water aerobics. A physical therapist can help you develop a home exercise program. Stretching, good posture, and relaxation exercises are also helpful. I find that physical exertion too much, and you have to find that, and it may take some flares and stuff to figure out, you know, where your limit is. I have yet to find it. I overwork and I get a flare. Pace yourself. Keep your activity on an even level. If you do too much on your good days, you may have more bad days. Moderation means not overdoing it on your good days, but likewise it means not self-limiting or doing too little on the days when symptoms flare. I don't know. When I flare, I gotta lay it down. I mean, I can't lay it down completely, like I said, because I have the care of my animals. But I do try real hard to limit my movement. I do. Whether it's good or bad, that's what works for me. Maintain a healthy lifestyle. Eating healthy foods. Limit your caffeine intake. Do something that you find enjoyable and fulfilling every day. This is what I'm talking about, and I think maintaining a healthy lifestyle, I think also comes under, and y'all tell me I'm wrong, because any of this y'all can agree or disagree with me, and I'm really hoping I get quite a few comments in the thing, and we're at 40 minutes. I don't know when to cut this off. Also comes under mental health, and I wish I could find it, and I guess had I done more planning, I could have found it. Let me see if I can type in. Give me a second, y'all. Diet, and I'm sitting over here with, so I'm not perfect, and I never claimed to be, so I don't want anybody to know. This is a tray of homemade German cookies from my mother that I've been munching on for breakfast. So I'm not perfect. So let's see. I'll put food's good for FIBRO. Basically, and I could read a bunch of these. This one article, it says, what types of food are good for FIBRO? Research has not linked types of food with FIBRO as of 2015, which is bull. I mean, they haven't, it doesn't cause FIBRO, but individuals diagnosed with the condition often benefit from keeping track of the effects of food on their bodies. Over 40% of FIBRO sufferers report some of the foods they consume make their symptoms worse, according to WebMD. So, anything processed foods, and I know you've heard me say this before, but I want to know how many of you have really tried to figure out what foods that you eat in particular make your fibros. Like for me, sodas. Okay, aspartame poisoning is a thing for fibro and non-fibro sufferers. I know if I have more than one soda in a row, I can't finish the second one these days. I won't put myself through it. I get nauseated. And I guess maybe because I don't drink it on the regular anymore. I really don't. This holiday season, I've drank it the most than I have the month before. It says, one way to take a closer look at the foods a person eats is to keep a food journal for 2 weeks, states WebMD. The journal should have a record of the foods eaten for each meal and snack. Individuals also record any symptoms, including headaches, fatigue, or gastro problems. After a while, patterns become evident, revealing foods that are most likely to cause problems. For me, I never kept a journal. See, I'm trying to move this. But any processed food, chemicals are not good for anyone, but chemicals in your body from FIBRO, even GMO foods, genetically modified organisms. And I hear that Monsanto is really, they own the world's food source. I mean, I see articles all the time. But in the beginning, I think they were trying to help with the world's food source, so they made a strain of like corn that is resistant to pests or something else, disease, which was good, but when they found out that it was making people sick, they didn't stop. So now it's very hard to find even corn that isn't genetically modified, but it's making people sick, and it's really bad for us. Now, I eat fresh corn and not knowing it's GMO or not, because to me that's better than eating crap. So any prepackaged food is not good for you. Do I eat it? Yes, especially when the kid's out of town. I try to limit it with, I eat a lot of fresh cheese because it's easy to either grab the block and cut it at the couch, or, you know, the string cheese that's already cut. But my daughter's trying to get me more whole foods. If you can, and I know it's expensive, Aldi's is pretty cheap if you have an Aldi, but trying to eliminate as much prefabricated food as possible, I promise you will help your symptoms. I promise you. Now, having said that, I just got through saying that, you know, you can get pudding cups and stuff like that. If that's going to help you temporarily, you got to eat something to keep your strength up. You know, I mean, if you can grab the hunk of cheese with a knife and keep saltine crackers over here or whatever, or some whole grain bread, you know what I mean? On a good day, toast enough and put it in a Ziploc bag so it's like crackers, then that's what you got to do to get through a day. But if you can eliminate that or be really conscious of your body, watch, like me, I know sodas. I find myself, my feet swell when I eat certain prepackaged food. Even if we have takeout Chinese, if they use MSG, and it's got to be, because we can cook Asian here and it doesn't affect my feet. So it's got to be, I swell up and I start feeling like crap. My body starts hurting more. Start being aware of the things that you're putting in your mouth. do the journal like they're suggesting, so that you know, and do your best to avoid them. I know Diet Pepsis or Diet Cokes make me sick if I drink too much of it. Do I avoid it altogether? No. We're not perfect. We're going to backslide. We all do. But doing your best to eliminate it, and you may have more willpower. If you start figuring out and being more conscious, every time I have this brand of canned corn, I seem to get really nauseous, or my bones or my fatigue seems to be getting worse. Okay, put that away for a week and see if you don't get that fatigue. You see what I mean? Try to avoid it as much as possible. I'm telling you, chemicals are bad for anyone, but for us, it just makes our inflammation really bad. And that inflammation starts pulling on our muscles, our nerves, and everything, and it makes it worse. With fibromyalgia, sufferers benefit from using food to supply the body with energy. Many find eating more frequently, but smaller meals provides a more sustained release of energy throughout the day. I know noshing all day helps. I find myself maybe not more energy, but feeling like my brain's more awake. Does that make sense, y'all? Because a lot of what we go through, our fog can be really bad. And our fog's already there. Then you add the fatigue and tiredness of our condition and not sleeping. Your brain can just feel like it's maybe not necessarily pain, but it's out here in fog. And it's almost like, like that fog is just swirling around and you can't focus or concentrate, or you just feel like, what? That's the best way for me to describe it, right? Y'all tell me if I'm right. I really want input. This video was designed to have a lot of input. Y'all let me know. Type in "made it" if you made it to this 50-minute mark. Morning stiffness, tingling or numbness in hands and feet, headaches including migraines, IBS, irritable bowel, sleep disturbances / insomnia, cognitive dysfunction with thinking and memory, painful menstrual cycles and other painful syndromes, sound sensitivity, light sensitivity, temperature sensitivity. Light sensitivity, that's one of the ones I wanted to bring up. Do you ever go shopping in the store, those artificial lights, do you start feeling anxious, nauseous, and things like that, more fatigued? That is a thing. That is a thing. And why shopping is so hard for you, not only the crowds. Like for me, if the shopping center is too crowded, I kind of get anxiety and panicky. Not a panicky attack, but panicky, but that's because of my eye, because I'm afraid somebody will knock me down and hurt me. But I know that the artificial lights kind of freak with me too. Sharp and aching pains in connective tissue areas next to the joint, muscle twitches, and more. I want the and more. God dang it. Give me the and more. You suck. I'll have to try to find the 200 symptoms. But there are a lot. My fluffiness. Okay, well. Try it a different way. Okay, 27 of the most common signs. Well, it'll get us more than the first few. I wish I would have printed. Here they are. Fibromyalgia is a complete chronic pain syndrome that affects every aspect of your life. This post will go over these symptoms as well as specific fibros. Here are some of the, I call them weird ones, besides the fatigue, memory, widespread muscle soreness, muscle spasms, tenderness, headache or migraines, rebound pain, irritable bowel syndrome, nausea, constipation, excessive gas, diarrhea, painful bladder syndrome, increased sensitivity to pain, pins and needle sensations. Oh my God, I call it one of them I call the voodoo doll one, and it's most embarrassing in public. You'll be sitting there minding your own business, sitting watching TV or watching a video or whatever, and all of a sudden it's like somebody's got a voodoo doll and pokes somewhere, and you're like, ow, it's like just a stabbing pain somewhere. God, that's embarrassing, especially when you're for an appointment or thing and you cry out and people are just turning around looking at it and you're like, oh, sorry. I hate that one. Increased overall sensitivity to cold and touch, forgetfulness, inability to concentrate, problems with balance and coordination. Okay, on my weight, my eye is, so that's off balance. My eye causes me to be off balance because sometimes I have a hard time seeing something as, as, what's it called? When you're depth perception, especially when I'm on even ground. And now you have the unbalance of fibro. I'm doomed, folks. Fatigue, depression, nervous energy, anxiety, emotional sensitivity. Y'all, any sensitive word on a commercial and it starts to well up. I have to push it down. Increased stress response, sleep disorders, joint stiffness, menstrual pain or changes, increased chance of other health conditions. Headaches or migraines, rebound pain. When rebound pain, patients are pain-free, their first instinct may be to jump up and get things done. They may clean their house, meet friends for lunch, then go for a hike in the afternoon with their kids. While these are all wonderful things, the increased activity can mean worse pain later, that night, or the next day. That's a flare caused by physical activity because you feel so good, you actually want to get stuff done in the house, so you start moving around, and then within a couple of days, you could even feel good the next day, but within a few days after, you'll get a flare. That's what I'm talking about. The irritable bowel, abdominal pain, cramping, bloating, diarrhea, nausea, constipation, excessive gas, either by the symptoms of IBS or it may occur as a result of dietary changes due to nausea or other causes. Do y'all get that? Nausea that comes out of nowhere. You just sitting there, you haven't eaten anything different, and all of a sudden you just get this. Yeah, I've gotten that. Smell. Sensory symptoms. One of the strangest effects of fibromyalgia is its distortions of patients' sensitivity to pain, cold, touch, or even sensory inputs like smell. Are y'all all of a sudden now sensitive to smell? That's not so bad for me. For me, I've become things like gory stuff on TV, which, the things I've seen in prison, it shouldn't get me, but even though I know it's fake. Pins and needles. Any involvement of the nerves may cause a tingling sensation in hands and feet, or referred to as feeling like pins and needles. Approximately 25% of fibromyalgia patients report poor circulation or numbness and tingling, which is not in a radicular, radicular pattern and typically involves arms and hands. However, a physical examination reveals normal muscle strength and sensory testing with no inflammatory or arthritic features. I've gotten the tingling, I've gotten the itching. Oh my God, the itching. For no reason, your pain presents itself as itching. So you can scratch yourself raw, because while you're scratching, and I don't find Benadryl helps because it's not due to allergy. Right now, my armpits, and I'm not going to show them to you because, you know, I'm kind of hairy bushwhacker. I've been having lumps in here, but I don't know if it's ingrown hairs, but it's like, I feel like I have like a tangerine under there, and right up here, it's red and inflamed, and when I have my daughter look at it, she says it looks like psoriasis, but I don't know. This is new. This is the longest itching. I hate when itching is in a particularly not so ladylike area. You have to suffer till you get home. In addition to increase in sensitivity to pain, which merits its own focus, many fibro patients also report increased sensitivity to cold, touch, odor, loud noises, bright lights, medications, and certain foods. Some people, fibromyalgia patients are so sensitive sometimes that even the slightest touch can cause them to flinch in surprise or pain. Nerve endings are hyper-aware and sensitive to even the slightest stimulation for seams and tags in clothing. Now, I'm lucky that so far I can wear clothes. Bras bother me, and I can't wait to get them off when I get home, but so far I can still remain dressed. I feel bad for those of you that can't. But because of increased sensitivity to cold, fibro patients may find themselves reaching for a sweater on the sunniest days. Forgetfulness, inability to concentrate, feeling hazy or blurry, lacking motivation, becoming easily confused, difficult focusing for extended periods of time, being unable to focus or pay attention. Y'all know I don't edit out that stuff in my videos. You can tell when I'm having a bad day. At least if you know me and been watching me, you can tell when the fog is bad. Problems with balance and coordinations. Many report having trouble balancing upright or maintaining basic coordination. This could be due to fatigue, certainly, but it's also a separate symptom of this syndrome. Fatigue, we've been through that. Depression, nervous energy. When they feel good, they may be almost frantic in their desire to do things, whether playing with their kids or simply getting household chores done without pain. This can result in rebound pain later on. We've talked about that. I've never been pain-free. Never been pain-free. I think I would sell my soul to the devil for just an hour of it. Mood swings. Sarah Jane, you've talked about this. Mood swings can also have a big impact on the everyday life of fibro sufferers. Many diagnosed with fibro can go from happy to angry in 1 minute or less. Very often, the sudden changes in mood are inexplicable. They can have a devastating effect on person's professional or personal life. I try really hard to keep that away from my kid. And when I know what's happening, I apologize. And thank God my daughter is very understanding. Sleep disorders, joint stiffness, increased chance of other health conditions. Women experience some symptoms at a greater rate and frequency than men who are diagnosed with fibro. Women also experience more pain than men, but often receive less treatment for it. The main symptoms in women are amplified pain, pain during sex, painful menstrual cycle, migraines, greater feelings of fatigue and depression, increased rates of IBS, restless leg syndrome, increased overall sensitivity to light, now noises, smells, and temperature. This is from the Pain Doctor, paindoctor.com. If y'all want this, this is a pretty good, even better than the Mayo Clinic. Let's see. Let's look at for the men. I know a lot of y'all ladies, I don't think I've had any man tell me so far that they have fibro. With fibro in women being much more prominent, it would be easy to assume that men don't experience it. They do, and their burdens is just as difficult. One man with fibro explains, it's a tough deal for a man to have fibro. One of my best friends doesn't believe I have it. His wife, who was a doctor, told him men can't get it. That it is in my head. That kind of hurts. Well, us ladies get that too. Men are diagnosed more infrequently with fibro, but diagnosis does occur. Injury and trauma to the body may be more likely to be the cause of fibro in men, but there may be a genetic link between mothers and fibromyalgia and their son, with fibromyalgia and their sons. For men who suffer, finding a good support group is just as necessary as it is for women. The National Fibro Association gives great tips on finding the support you need. I did not know about that. The National Fibromyalgia Association. I need to go there, and maybe in my next video about fibro, I'll go there. The National Fibromyalgia Association. Okay. Well, we are an hour in. I will probably have to edit because I'm only allowed an hour video. So I may cut some of this out. Hopefully I don't cut out the good parts. Hope this was helpful. Please, please, please give feedback. You agree, you disagree, things that help you. Have you noticed foods? Maybe we can help each other out. Please, please, please comment. God bless y'all. Positive vibes out to each and every one of you. Remember to always be kind. And I will talk to y'all real soon, okay? I love y'all. Bye.